Been about 2.5 weeks since the CDC issued a nationwide health alert about kids with hepatitis and adenovirus infection. 5 have died, 2 have had to have liver transplants, and 100 others have had to be hospitalized. Why this is happening now in the U.S. along with a worldwide outbreak isn't something national experts have been able to explain as of yet, but everyone can agree there is cause for concern. Dr. Brad Pollock, UC Davis epidemiologist and chairman of the university's Department of Public Health Services, with me now live to try and help us understand what we can about where we are now. Good morning to you.
Good morning, Sinceri.
There can be the contagious hepatitis virus, and then certain meds and specific toxins can also cause this illness, which attacks the liver. The cases in this outbreak have also come along with adenovirus infections, which can be responsible for respiratory illness, gastroenteritis, conjunctivitis. How unusual is this current hepatitis situation to you?
Extremely unusual. And again, there have been, over 100 cases that have been identified so far in the U.S., just handfuls in different states. We don't really know what's causing this. This is why us epidemiologists get to do our work, which is to try to figure out what's going on. But these cases here, some of them have been associated with this adenovirus type 41, which is a subtype of that virus. But not all of them. And we don't really have good data yet on what proportion of folks out there are infected with that virus and whether that really has any role in this. So we're still at the very, very early stages of trying to figure out what's going on.
The State Department of Public Health says 7 young California children have come down with hepatitis since October of last year. We don't know about the adenovirus implications here in our state. Fever, fatigue, loss of appetite are some of what parents need to be keeping an eye out for, and not being able to keep fluids down is another big red flag in all of this, right?
That's right. But those are very nonspecific symptoms, right? And in fact, the more common infections with this particular adenovirus are ones that cause gastritis. So you'll have diarrhea, stomach upset. So that would be associated with this. But those are also very common symptoms for many other common diseases, including influenza and so on. So we really have to start surveilling this very carefully, examining all these cases that we're identifying, trying to see what's going on. We still don't know whether this adenovirus is really statistically significantly associated with this particular set of hepatitis cases that we're seeing now in kids.
Most of the hepatitis cases in the eastern United States and Europe involve the adenovirus type 41. There are routine pediatric vaccines that prevent Hep A and B, right? But there isn't one for this adenovirus type 41?
That's right. And again, because it's usually not something that causes severe illness. So that's why we're still not clear. And again, we don't know what proportion of these hepatitis cases with precision have that viral infection. We just don't know. So it may or may not be associated with it. As you said, there are other things that can cause hepatitis, which just refers to sort of inflammation of the liver. It doesn't really refer to the cause or the etiology of that particular case. So we still have to investigate that. That's really what we have state health departments for, and the CDC. They do these outbreak investigations. That's what got me into epidemiology when I was an undergraduate. We had the Legionnaires outbreak in Philadelphia, and I got interested in epidemiology by hearing about these detectives that went out to try to figure out what was going on.
That's just what I was thinking, you disease detectives to lead us through all of this. As concerning as this hepatitis outbreak is, nationally, doctors are also worried about increasing measles cases. Luckily, the State Department of Health says no cases have been reported here in California so far this year. 17,338, though, have been logged nationwide, almost 7,600 more than this same time last year. Vaccination rates for kindergartners dropped this year nationwide, blamed on missed appointments during COVID. Might California be dodging this because of our strict school vaccination requirements, COVID time or not?
Yeah, I think, well, you're absolutely right that we had a lot of missed visits, not just for kids, but even adults, and things like cancer screening services and so on. We're seeing the effects now, these health effects of not getting regular health care, and immunizations for kids is certainly part of that. So yes, I think states that have very strict immunization requirements like California probably will see less of an impact. We're getting a higher proportion of our kids vaccinated for measles and other common childhood illnesses. So I think we'll fare fairly well here, but that's not necessarily uniform across the U.S.
And just quickly before we run out of time, we're now up to 71,000 daily cases of coronavirus being reported across the country. That's doubled in the last few weeks. We know that extra booster has already been approved for most of the population, but we're also looking at BA4 and 5 in terms of the Omicron subvariants, possibly 100 million new infections as we go into the fall. Are we going to have to get 5 and 6 boosters to make it through winter?
We don't know. I know that the second booster dose was approved, and I got one before I was ready to travel a few weeks ago to Chicago, just because I didn't know what was going to happen other places. But we still don't know yet about how often we're going to have to do boosters. And remember, the other thing that we're expecting to see on the market at some point in the near future will be the boosters that are programmed specifically for some of these subvariants. Right now, the mRNA vaccines that we're getting are the same ones we had at the beginning that weren't really programmed specifically for the variants of concern. So much like influenza every year where they reformulate the vaccines, I would expect we'll have something similar to that with SARS-CoV-2. Again, how often we're going to need to get boosted is still not determined. It may be less than once a year. This is a virus that actually is a little bit more stable than influenza in terms of its mutational change. So we're still waiting to see what will happen with that. But it's probably the case that we will need to get boosted in the future to continue to be able to fight off the virus.
Alrighty, so much to follow. Dr. Pollack, thank you again for helping us understand as much as we can right now about all of this. We appreciate you.